Are you a midwifery student who needs to get your clinical work in? You're doing your didactics, but you need that hands-on aspect. So Birthing Your Way is the perfect place for you. We are located in Lehi, Utah County, and we have a flourishing practice here. What makes us unique from other birth centers and practices is the scope of care and the scope of practice that you're able to see and experience and learn from. We do twins, breeches, VBACs, but we have a doctor on staff, and that makes it so that we can do a lot more. You will learn high blood pressure, how to manage it, not just with medications, which most of you can't do the medications, but it's nice to know what is needed when you need to refer out. But also diet-wise, we use herbs, we use homeopathy, we use essential oils, and we use medications. There's a time and place for each of them, and we want to teach you those things. So some of the complications that we deal with on a regular basis are hemorrhaging and shoulder dystocia. We have the occasional resuscitation, pretty much equal to the amount that you would see in any practice. But we don't have to transport as quickly because of the medications that we have. And because of the licensing that we have, we can keep our patients much longer. I am a family nurse practitioner and a licensed midwife. And so I'm able to help with things in pregnancy that normally, before I was a family nurse practitioner, I had to refer on. So you can learn those things. Now, you may not be able to do all these things in your practice, but knowing what to do and who to turn to can make the difference between a healthy pregnancy and an unhealthy pregnancy. So you are going to learn how to manage high blood pressure through diet, through supplementation, and through medications. You're going to learn about gestational diabetes, type 2 diabetes, and many other issues that may come up. Having Dr. Baird on staff is wonderful because we can consult with him if a baby has transient tachypnea. But if baby has that, we can consult with Dr. Baird and find out if it is good to stay here, find out if we are able to keep baby for observation or if we need to transfer to the hospital. Working with IVs and multiple different hemorrhage medications. So come and check us out at Birthing Your Way. We do have accommodations for students coming by themselves. If they're coming with family, they will need to find additional housing, but we do have some good stuff. We only do a few home births a year. We don't do many anymore. Most of our births are done at the birth center. Therefore, a vehicle is rarely needed. We take phase 1, phase 2, phase 3, and phase 4 students. Now, phase 1 students, those are a little bit different. We are a little bit picky. They must know how to take a blood pressure. They must know how to do heart rate. They must know how to use a stethoscope. They must know how to dip urine and use a pregnancy wheel. We prefer you to have phlebotomy skills and medical assistant skills. Phase 1 is not strictly observing. We don't have a strict observing phase. We expect you to get in there and get hands-on. So we are not here to teach you the very basic skills. We need you to come with basic skills and we help refine those. For instance, we do not teach phlebotomy here. We do a lot of phlebotomy. We do a lot of vitamin IVs because we also have a family practice that you can get experience with those things. We don't teach you IVs though, or blood draws. We teach you the tricks of drawing blood and the tricks of starting an IV, floating a catheter into the vein. We will teach you how to get difficult veins, but you need to have the basic blood work skills down before you come here. You will be very hands-on. We expect our students to have a good base, a good foundation so that they can jump right in and get started. We have you typically observe your first day or 2 at the most, and then we get you right in there going. The EMR that we use is client care, so you will want to become familiar with client care. You can typically get a 30-day trial account with client care, and we recommend that you do that so that you are familiar with it, because once again, we're going to get you straight in there and going and get that responsibility built. You truly are primary under supervision. And so we want you to feel comfortable in those skills as much as we can. As I said, we are here to refine your skills to help in difficult times. We are not here to teach basic skills. For more information, you can go to www.studentmidwifeprogram.com. We have videos that you can watch. We have an application form and a lot of different information for you. Now, let's talk about short-term and long-term, okay? Short-term is typically about 2 weeks. That is usually the minimum we will take somebody. Let's say you need to fly back and forth. You need to come earn some money and then come out for a couple weeks, go back home, take care of children, whatever the situation that you have is. And you can only come for 2 weeks at a time. That is fine. But make sure you don't have too much time in between so that you can become familiar and get that muscle memory. You don't want to have 6 months in between and forget. We do take students that come for 2 and 3 months at a time. We've even had students move here and be with us for anywhere from 6 months to 2 years when they were starting out from the very beginning. So we don't have a limit there. However, if you are coming and going for short periods, that can restrict your availability, because if I have somebody here in a primary position that is going to be here for 6 months, they get priority. But if I have 2 students that want to rotate, they are more than welcome to do that. We take 1 primary student at a time or 2 that are rotating. We can take 1 to 2 phase 1 and phase 2 students at a time. Ideal is a phase 2 and a phase 3 student, or 2 phase 2 students. So get on our calendar, get reserved. You're going to have a great experience here. You're going to get a lot of hands-on, and you're going to see a lot of things that you will need to practice on your own.